I'm going to be discussing Care Plan 3. My nursing diagnosis is ineffective coping related to inability to adapt to the demands of daily living, evidenced by refusing to do incentive spirometry and deep breathing and coughing exercises. I did this nursing diagnosis by gathering subjective and objective information and putting it into a clustered data group with everything that would go along with the diagnosis. My short-term goal is for Miss Scott will be able to communicate her feelings about her present situation and explain why she is refusing to do incentive spirometry and deep breathing and coughing exercises by the end of the week. My long-term goal is that Miss Scott will demonstrate the ability to properly use and perform at least 2 of the breathing exercises daily until discharge from the hospital on November 20th, 2020. My interventions are, number 1, the nurse will explain the reasoning and importance behind the incentive spirometry and deep breathing and coughing exercises and get feedback from Mrs. Scott on the morning of November 13th, 2020 in her hospital room for 30 minutes or until she has a full understanding of the exercises. This can help to allay her fear and allow her to regain a sense of control with her treatment. Education can help her understand why the doctor has requested these exercises and give her more reasoning as to why she should listen. Number 2, the nurse will encourage the patient to make positive healthcare choices and participate in the planning of care and scheduled activities, which is her incentive spirometry and deep breathing and coughing exercises, in her room for 5 minutes every morning until November 20th, 2020. Encouraging her to participate gives her a feeling of control and can increase her self-esteem revolving the situation. Number 3, the nurse will spend 45 minutes of uninterrupted time with the patient in her room for 1 week to encourage expression of feelings and try to identify the factors that are causing Miss Scott's ineffective coping to her breathing exercises. Devoting time to listening helps the patient to express emotions, grasp the situation, and cope effectively. My evaluation for my short-term goal was that it was met by November 17th, 2020. The nurse was able to talk to Mrs. Scott and get a better understanding of why she was refusing her breathing exercises. She stated that she really didn't think they were necessary. I went in for a hip surgery, so I don't know why I was having to do extra breathing exercises. The long-term goal was met by November 20th, 2020. After talking to Mrs. Scott about the importance of breathing exercises and understanding her concerns, she was able to demonstrate how to properly use and perform her breathing exercises. Mrs. Scott performed her breathing exercises in the morning and at night until her discharge on November 20th, 2020.